We have with us online Dr. Nauman Zafar, who is a physician of internal medicine as well as an assistant professor of medicine in the University of Florida. Thank you, sir, for joining us.
Thank you very much. Thank you very much for having me here.
Dr. Nauman, now the WHO has said that the coronavirus may never go away. The head of, Dr. Mike Ryan, who's a emergencies director of WHO, has said that this virus may just be another endemic virus in our communities, such as HIV, and also, the communities may have to just live with it. And we've also seen that even viruses with vaccinations, such as measles, don't necessarily go away. So could this be a realistic scenario that people all over the world will now have to live with?
Yes, this is a possibility that once the virus is spread all over the world and it's the huge number of people are being affected. So there is a possibility that this virus will actually stay. And even if the number of cases go down, but still there will be some people around the world, around your country, in the cities, they will have the virus and they will keep transmitting. And obviously, we are waiting for a vaccine. Until the vaccine is out, everybody is at risk. Yes, once the vaccine is out and everybody will have vaccine, the overall the condition will improve. But until then, obviously, the virus is it looks like it's still here. And even
Right,
after the
sir.
vaccine, go ahead.
Right. Right. I was
Yes, yes,
saying
please,
that
your question.
even after, you were saying even after there is a vaccine, there are a lot of other issues to be considered. I'd like you to continue on that, but also one of them is mental health, which is meant to be a real big area of concern. Even according to the WHO now, people have gone through extreme isolation, fear, uncertainty. Nobody knows where the economic situation will end up. Mental health is coming to the forefront in a huge part.
Actually, a very interesting question and very good question. I'm a primary care physician, and that's what I do every day. So I'm seeing all the patients on telemedicine, but every other phone call I'm getting is actually about anxiety and depression. There are like in United States, there are 36 million people who have lost their jobs, and the people who are still working means everybody is scared and everybody is worried about the future because obviously if you see there's so much numbers of cases and we're all worried that it may not go away at least until the vaccine is here. The question is what happens after vaccine, nobody knows. So there's a fear of unknown and that causing a lot of anxiety, and that's very very important for all of us to understand that is anxiety. I mean, if we obviously keep thinking about it, we're going to have more anxiety, but I mean, there is no way that we will not be able to think about it. But normally, what we recommend as a doctor is that every day, yeah, even there was a lockdown going on, then at least in the house, and if you can go out, keeping the social distance, do the exercise. So exercise probably, as a physician, I can say is the best remedy at this time, at least half an hour, 15 minutes, 20 minutes. But yes, this is a major issue here in United States also that a lot of people, I mean, almost 50% of my patients are having anxiety, just sitting at home and then fearing that what's going to happen in future about their jobs, about their businesses. But I think yes, until the vaccine is here, we might have to just stay with this whole situation, but we have to be very smart about it that we do keep the social distancing, keep wearing the mask as much as we can. I know it's very difficult sometimes, even a mask, even for us. So, but the United States and CDC is following like a whole platform that once they are reopening the country, how they're going to do it. Because of economic impact is so much, they have to open the country. So increasing the testing, and there's one very interesting concept is coming up here in the United States about the contact tracing. So contact tracing is anybody a patient meet, any patient is positive for corona, they can definitely right away do the testing and then do the contact tracing. There are some
Right.
apps being developed by Google and Apple. There's some privacy concerns about those apps too, but that's what they are planning to do, and there's some trainings going on in universities that how can they do contact tracing. As soon as we have like a positive case, right away you track their contacts and test those people. So in this way, you right away quarantine those people who are positive. Because if you leave this person alone who's positive, he's going to keep spreading the infection everywhere.
Right. Thank you for joining us, Dr. Nauman Zafar, who's Assistant Professor of Medicine at the University of Florida, giving his insights about how our life might be going forward if the coronavirus actually does not go away, which is a very realistic scenario that we could be facing coming forward.